Cognitive deficits can be an early indicator of psychotic illness such as schizophrenia. Many people with schizophrenia have reported sudden difficulties reading, concentrating, or remembering things in the earliest days of the disorder. So, there's been an interest in developing tools that psychologists and researchers can use to look at cognitive function in schizophrenia. One of these is the Brief Assessment of Cognition in Schizophrenia, or BACS, which is a pen and paper test battery that takes 30 to 40 minutes and looks at a patient's or research subject's verbal memory, working memory, motor function, verbal fluency, processing speed, and executive function. The BACS has been translated into many languages, validated for different countries' populations, and used in over 100 peer-reviewed publications. So, how does it work? Psychologists use sets of tests or tasks, collectively called batteries, because the questions they want to answer can be too complicated to explore with just one test. The BACS battery for schizophrenia can include the following tests: a verbal memory test, where patients receive a list of words and have to recall as many as possible; a digit sequencing test, where patients get clusters of numbers and have to order the numbers from lowest to highest; a token motor task, where patients receive plastic tokens and have to place them in a container, 2 at a time, as quickly as possible; a verbal fluency test, where patients have 60 seconds to name as many words as possible in a certain category; a symbol coding test, where patients match numbers 1 to 9 to symbols on a response sheet; and a Tower of London test, where patients see 2 pictures of balls of different colors arranged on 3 pegs and have to identify the number of times that the balls in one picture need to be moved to be arranged in the same way as in the second picture. How have BACS results been used? In past studies, researchers have found that healthy people with greater polygenic or genetic risk for schizophrenia have lower BACS scores. According to these results, even if you're healthy, if you have a high genetic risk for schizophrenia, you might still show some of the deficits associated with the disorder. Researchers have also compared BACS scores between patients with schizoaffective disorder, schizophrenia, and bipolar I disorder, and found that while all 3 patient groups performed worse than healthy controls, bipolar I disorder is associated with less severe cognitive impairments.